Hello, I'm Chris Boswell, the Mayor of the City of Harlingen. I want to thank you for watching this video to learn a little bit more about what's happening with the coronavirus pandemic here in the City of Harlingen and throughout our county. As you know, the hospitalizations in our city and in the county and throughout the Rio Grande Valley have really gone up enormously just in the last couple of weeks. As I told you, if you've watched these videos before, that has been the primary indicator, and it looked pretty good a few weeks ago, but just in a very short period of time, those numbers have changed. 2 weeks ago when I talked to you, I showed you how the increase had occurred, a six-fold increase over a short period of time, but that increase has gone up even further. Today, instead of 181 that we had 2 weeks ago, we have over 257 hospitalizations related to COVID-19 just in the city of Harlingen. And throughout the county, that number is double that, because the Brownsville hospitals have just as many. And so it is putting a tremendous strain upon our hospitals and our healthcare workers in those hospitals. They're doing heroic work, and I hope that each and every one of you will think about how hard their job is right now as they struggle to open beds and get people the care that they need to get. And so what I really want to talk to you about today is how we can help them, because we really do need to help them. And the way we need to help them is to continue to do things like to wear the mask and to distance and to wash. So wash and distance and wear masks. So you can see from this chart here that the rate of infection for people who don't wear masks is very high, and the rate of infection if both persons wear masks is very low. So by wearing a mask, you're not only helping to protect yourself, you are contributing to helping to protect others. And in that way, you are helping our hospital care workers as we need to get these numbers of admissions down. We can do as much with masking and distancing and washing as we can with shutting down. So if everybody continues to do their part, I'm very proud as I walk around the community, I go into stores and other facilities, that people are taking this seriously. But we need to do it also in our family settings. We need to not gather so much with our families, not have the big barbecues, not have the big parties. Keep those gatherings small, less than 10 people. If you go to the beach, and you don't necessarily need to go to the beach, but if you go to the beach, follow all those rules. Stay 15 feet away from somebody else and just 2 people under an umbrella. Those are where we're seeing the big spikes, is in these gatherings of people, in social gatherings, and those are the things that we really need to try to keep from doing. UTRGV Health is a huge resource for our community, and you can go online if you feel sick. There's some things you need to do. You need to either stay home. If you don't know what to do, call UTRGV and they can give you some guidance. There's also some material that come out from MD Anderson Hospital and Medical Research Institute about what we can do and what we understand now about the transmission rate. And so the transmission rate really occurs when people are not wearing their masks and when they are around each other for more than 15 minutes in close proximity. So this article that we're going to show you here online is something that you might want to take a look at to really understand how this transmission occurs. But it's certainly clear that when you're around somebody for at least 15 minutes, you can infect them or be infected, especially if you're not wearing the mask. So we need to remind each other and encourage each other and encourage our family members, our business associates, to do these 3 simple things. Wash, wear the mask, and distance yourself at least 6 feet as much as you possibly can. And again, we do this not just because it's something that we're being told to do. We need to do this to help our neighbors who are over at our hospitals right now and our first responders who are exposing themselves to this virus every single day. And we need to try to help get those numbers down in the hospitals. So I ask you to continue to do what you're doing, to think about the hard work that's being done by our healthcare workers at the hospitals, and to do your part by encouraging others and by setting an example of doing the things that we need to do to keep our community safe. So stay safe. We will get through this. We will not panic or despair, but we will work harder to make sure that we can control the virus. Thank you.